So when I came out of the hospital, I was on the happy juice. I didn't know exactly where I was. And the doctor probably told me when it was time to take the catheter out or when he would do that, but I don't remember when. When do I know that it's time to remove the catheter?
You're going to go home with specific discharge instructions for your surgery and for your catheter. Some of the doctors will have you take it out the next morning, early in the morning. Others may want your catheter in for a week, and they'll give you a specific time to take it out. Okay. Some doctors will have you take the catheter at home. Others will have you come in and have a nurse take it out for you.
Okay.
Some of it just depends on your comfort. It's not a difficult thing to do. We'll send you home with instructions exactly what I'm going to go over with now to remind you, plus we'll teach you about how to do it while you're in the hospital.
It sounds like it's going to hurt. Does it
No,
hurt?
it doesn't hurt at all, honestly.
Okay, good.
It hurts more probably just to tolerate the catheter, and the catheter really isn't something that hurts. We give you medications for the frequency, the urgency. You may have a little burning and stinging. That's why you want to drink lots and lots of fluids. Okay. You may have the burning and stinging when it's first put in, and then when we first remove it, you could have a little blood in your urine. You want to drink lots of fluids that day. Okay. But within several hours, you will feel like you won't remember you had it in. Okay. It'll be fine.
All right.
The catheter is held in place. Remember, we talked about this earlier.
The balloon.
With a balloon filled with water. So how you're going to remove this is you're going to deflate the balloon. I usually tell patients to do this process of removing the catheter in the bathroom because occasionally the little bit of water in here will run out on the floor, urine might get spilled, and I don't want anyone in your family to fall on the slip on the tile, so be really careful.
Okay.
You know, you could do it in the shower if you know it's age appropriate, but I just don't want a little person falling in the shower and hitting their head. So, you know, if you're someone that doesn't feel comfortable doing it, either call and have us remove it or have a loved one take it out. There's a side tail or a pigtail off the side of this that has a colored strip on it. This colored band is different. You may not have this color. The color goes with the size catheter you have in your bladder. So you're going to cut this catheter to remove it above the plastic band.
Can you show me how to do that?
Yes, I can. You take a clean pair of scissors. You want to cut right above the plastic piece here.
About halfway between.
Now, what happens, notice, is the balloon deflated. This one was just filled with air for demonstration, but water will actually run out of this catheter when you cut it. You just wait a second or two, and then take a deep breath, and when you are pull it out.
Pull it out. Quickly, slowly?
I would pull it out quickly, as long as it's deflated, and it will be deflated if you cut it, because cutting it releases any fluid that's in there.
All the pressure's gone.
It doesn't really hurt. Yeah.
Okay. All right.
Then you just throw all this in the trash.
Okay.
And you're done. After you've removed the catheter, you want to urinate within about 4 hours.
Okay.
Drink fluids, and then attempt to void. And if you can't go, you need to give the doctor a call at 541-334-3350, and they'll tell you what you need to do. But mostly we'll have you probably come in and we will take care of the issue.